My name is Andres Leone and I am the Medical Director for Palliative Medicine Services, but also the Program Director for the Hospice and Palliative Medicine Fellowship. I believe that as we have more and more programs appearing to provide training for hospice and palliative medicine, they are very similar. I would say ours is an older program. We have been practicing hospice medicine for several decades, palliative medicine for 15 years plus, but our fellowship program is younger, so 3 years or so, which can be a positive because it provides some additional flexibility that other programs may not have. One of the things we have found is that we want to encourage our fellows to do whatever they're passionate about, whatever they love. I think ultimately is what tools can we give our fellows so they can do whatever they like doing.
I'm Ben Thompson. I'm currently a fellow in hospice and palliative medicine at Prisma Health. I've known I wanted to do palliative care since the first year of medical school. Some of my decision to come to residency in Columbia, South Carolina was based on the fact that I knew they would have a palliative care fellowship. I've always been interested in the ways that we can communicate effectively with patients and help advocate for them so that the treatments that they get match their goals. Because this is a small program, I felt like I had lots of educational opportunities and I wasn't fighting with other groups to get them. I was able to do a lot of complex pain management, work with patients who were being evaluated for left ventricular assist devices, patients on ECMO, and all of the ICU patients with complex medical decision making.
One thing I like about our program is maybe make sure that also we have that good foundation of clinical education per se, research, grants, but also that excellence and compassion, just to have all those and make sure that the fellows receive training in all of those areas.
I feel like the clinical training was very appropriate for my skill level and my comfort level. I never felt uncomfortable with anything I was asked to do in providing care for patients, and I always had great supervision. This training has provided me with a lot of flexibility in the amount of supervision and autonomy. I feel like I've gotten to be an independent provider pretty quickly. We have a team comprised of 4 nurse practitioners, 2 social workers, a chaplain, and a nurse, and because of that we can provide interdisciplinary care where we're able to approach problems from our own specific backgrounds to provide excellent care for the patient. Our team's communication has been outstanding and it allows us to provide that care efficiently. The conversations that we have with patients and their family can occur from 8 to 5, Monday through Friday, but they're emotionally draining. This program has done an excellent job of supporting my mental health. We have didactic time, time for educational activities. We meet with our social workers for guided imagery and relaxation sessions, which were surprisingly effective. And we also meet with our campus mental health counselors once a quarter, just for an emotional check-in. I've appreciated the time that this program has given me to focus on work-life balance. I've loved my time in Columbia. I've been here for 4 years now and I've gotten pretty involved with the community. We live in a wonderful neighborhood where my wife and child and I like to take walks with our dog. So it's been a really great place to have my young family.